So my great honor and pleasure, welcome once again all of you to this 55th edition, and none other than Dr. OP Singh sir is there with us on a most interesting topic and somewhat controversial also now, sir. So I think Dr. OP Singh will address it well. Next slide, please. So let me introduce Professor Dr. Tofan Pati sir from Katak. Sir, I'm skipping your CV. Please skip our CV so that we can go to the chairperson. Sir, over to you.
Thank you, Alim. So I welcome everybody, Dr. OP, our speaker, and there is galaxy of stalwarts in the audience as I have seen and interacted. We have also Dr. Puspa Mishra. Before I introduce, I am welcoming her to this meeting. So the President of Indian Psychoanalytic Society, and I sincerely look forward to her inputs. Our moderators, Dr. Amrit Patjoshi and Dr. Adim Siddiqui, and who are well known. Therefore, we'll go to the next slide. Pavan, please share. Dr. Ravinda Brahma, our chairperson, is the director and consultant psychiatrist of Girindra Sekhar Clinic, Kolkata, and is the honorary secretary of IPS System Zone, General Council member of Rehabilitation Council of India, Journal member National Advisory Board of IAPP, Chairman IPS Publication Committee. Awards he has received, got seven national and zonal level awards of IPS and IAPP, during prestigious Bhagavad Award in 2007 and Marfate Award in 2014. He has also received Mother Teresa Sadbhavana Award for social work, publications, more than 50 publications. Dr. Ravinda Verma, I tell you that he works in the Girindra Sekhar Clinic, which is in the premises of the Psychoanalytic Society, which was founded by late, great Dr. Girindra Sekhar Bose. Next, please. My dear old friend and the veteran psychiatrist from Ranchi, Dr. Said Akhtar, MD, DNB in psychiatry, worked in CIP as a medical officer since 1979 and retired as deputy medical superintendent in 2014. Had been editor of Eastern Journal of Psychiatry and convener of legal subcommittee of IPS. Interests in legal psychiatry, headache, sexual disorders, and psychopharmacology. More than 80 publications in international and national journals. Currently, he is in private practice in Ranchi. Welcome, Dr. Said Akhtar. Welcome, Dr. Arvind Brahma. The meeting is yours. Please take it.
Thank you very much, sir. Thank you very much from the chairpersons. I feel privileged and honored to chair the current session of Tuesday Musing on this topic of revisiting Freud in the current 21st century clinic. When I joined Central Institute of Psychiatry in 1979, my director was Dr. Shashi K. Pandey, who was trained in Johns Hopkins in psychoanalysis, and he was a psychoanalytic oriented psychiatrist. So when we went to the OPD, his OPD used to be Wednesday afternoon OPDs, and for one patient, we used to devote more than 2 to 3 hours for one patient. And he usually demonstrated us everything what the psychoanalysis was all about. The Freudian sleep, the psychopathology of everyday life, the dream analysis, the level of consciousness, ego, superego, id. Then he also showed us how to interview the patients and use the psychoanalytic paradigm in different situations. We also did a lot of pentothal assisted interviews those days, and looked into the unconsciousness level of the patient and used it as a therapy. We were taught about the transference, counter-transference, working through, and we used to use these as a psychoanalytic measures. So actually, at that time, there was some evidence that people were having some interest in psychoanalysis at that time, but it was really getting declining from that days also. So 40 years ago, this was the situation. Today, the psychoanalysis has been marginalized and is struggling to survive in the hostile academic and clinical environment. This raises the question whether the paradigm shift has any relevance today in the present scenario, whether psychoanalysis is itself is of any use in the present scenario. To talk about this, we have an eminent speaker and learned friend, Dr. O.P. Singh, who has been, who does not need introduction, but our co-chairperson, Dr. Arvinda Brahma, will actually introduce him in detail about his achievement and he will deliberate on that. So over to Dr. Arvinda.
Thank you, Dr. Sai sir.
Hmm.
Dr. Tufan Poti has just told about Indian Psychoanalytical Society and Girinder Shekhar Bose. So just to start with that, in 1922, in 14 Parsibagan Lane, Kolkata, where Girinder Shekhar Bose started Indian Psychoanalytical Society, and for the last 1 year, we are celebrating the 100 years of this Indian Psychoanalytical Society. Unfortunately, because of the pandemic, we are doing all the seminars in the webinar form. We cannot do it physically. So this is something definitely a matter of cherished for all the Indians, because Indian Psychoanalytical Society is one of the most active branch of International Psychoanalytical Association. And today we have Dr. Pushpa Mishra, the President of Indian Psychoanalytical Society, with us. Now, regarding today's topic, Dr. Said has rightly said that this psychoanalysis is definitely marginalized nowadays. But I think our speaker will tell us. But some of the Freud's most important contributions, like the significance of unconscious early sexual development, repression, then dream, death and life drives, and transference, they are probably till date their significance. They have their own significance to us, so that we will learn from Dr. O.P. Singh. To introduce O.P. Singh, as we all know, he needs no introduction, but just to do the formalities. Professor Dr. O.P. Singh, he is the Professor of Psychiatry in West Bengal Medical Education Service. He is currently the Honorary Editor of Indian Journal of Psychiatry. He is the ex-editor of Eastern Journal of Psychiatry and ex-secretary of Indian Association of Geriatric Mental Health. He is also an expert to Government of West Bengal for Mental Health Program 2007 to 2011. He has published about 82 papers, including 2 books and 5 book chapters. So this is all about a very short introduction of Professor Dr. O.P. Singh. So now may I request Dr. O.P. Singh to start his deliberation. Omda, please.
OP sir, you have to unmute yourself. OP sir, you are in mute mode.
Sorry.
Sir, please unmute.
Sorry. Good evening, everybody. First, I must say my thanks to Dr. Tufan Pati, Dr. Amrit, and Dr. Alim, and of course the Odisha State Branch for inviting me here and giving me this chance to talk on Freud. While this telling about this, I must say that the topic was suggested by my friend Dr. Gautam Saha, President IPS, that you should talk about it, because I have been talking like in friends about it. And it was very gracious of Dr. Tufan Pati, Amrit, and Alim to agree to this. So there are some caveats. Like first, I am not a psychoanalyst and have not been trained in psychoanalysis any time in my life. So my perspective will be from maybe from a school student who have read about Freud and was fascinated by the insights, and maybe landed up medicine and took psychiatry, uh, not taking medicine or general medicine or anything. So this is, and then rediscovering what can be used and how it can be relevant. So basically, and I want to raise a lot of controversies also, so that I welcome all the stalwarts. There are many stalwarts here. I cannot tell everybody's name. So they are here. So I think there will be good discussion. And so I want to just touch upon those topics and let the discussion come. So basically, I will be talking about Freud and how, whether it is useful in today's world or our clinic. So why talking about Freud today? So as Lear said in a paper in 1998, Freud is dead. He died in 1939 after an extraordinary productive and creative life. It is important not to get stuck on him like some rigid symptom, either to idolize him or to denigrate him. Similarly, you know the Eric Kandel, who got Nobel Prize, is is one of these one psychiatrist to get this, and he talks about he was basically interested in psychoanalysis, entered psychiatry for that, and drifted to or changed his direction, and while doing research on memory, he became a neurobiologist and got Nobel Prize for that. He said that indeed, in context of these contributions, few would challenge Freud's position as the great modern thinker on human motivation, or would deny that our century has been permanently marked by Freud's deep understanding of the psychological issues that historically have occupied the Western mind, from Sophocles to Caesar. So, with these quotes, I will say that this is the still after, in fact, 150 years almost, and still people are talking about him. And the influence on literature, art is simply phenomenal. It has been, can be compared only with Kant, Descartes, and other philosophers. So, this is again a quote from Freud. He had a scientific bend of mind, and he says that from error to error, one discovers the entire truth. So, I should talk about the Freud's journey also. You know, I know this learned audience, I'm not just touching briefly on this. He was trained as a physiologist under Ernst Bruck, and he joined clinical work as assistant to Theodor Maynard. And there he was exposed to psychiatry first. And he got a scholarship and went to Paris to work in Sarko's clinic. We know the neurologist Sarko's joint. And there he was exposed to hypnosis. And in fact, he was sent to Nancy, where Bernheim used to do demonstrate in grand lectures the hypnosis. And he was very much fascinated by this, how the persons were getting well after this hypnosis. So that led to his interest in this hypnosis. And ultimately, you know that he found that hypnosis effects are short-lived, and he developed his technique of free association, where he thought that a person can reach his unconscious and main things which has been happened, and that effect will be long lasting and lead to his foundation of psychoanalysis. So initially, as a neuropathologist, he has a marvelous work. His first publication was the case report on cerebral hemorrhage in scurvy, which was very much appreciated. And he found the new staining technique for nerve cells, gold chloride, and the article was published in Brain in 1884. The neurology journal, we still know. Incidentally, my first paper was also in Brain with epilepsy with neurologist friends. Then he went on to 3 papers describing structures of medulla oblongata and connection with cerebellum. Since now neurons were visible, nerve cells were visible, they were not called neurons at that time. And he could describe them and this connections. And he had a seminal work on aphasia. And of course, his well-known description of cocaine and its local anesthetic effect, particularly on mucous membranes, which ultimately led to one of ophthalmologists who was in his circle to try experiment it on animals, and ultimately it was used as a local anesthetic in ophthalmic operations. Again, he described the emanation of nerve fibers from nerve cell stoma, 8 nerve origin and course, emergence of concept of cytoskeleton, movement and nucleoli in nerve cells, role of nerve cells as a unit in nervous system, and existence of contact barriers. This is something which was very kind of dear to him. In his project, which was not finished, and in fact it was published after his death, and he tried to reconcile his thoughts with the current understanding of neurophysiology and neurochemistry. And he described these contact barriers. He said the electrical flow does not occur in a linear way. It may be in the least path. If less energy flows in different path, and if there are higher energy, it flows through the other path, and where it can overcome the barriers, which is called contact barriers. And this was done before 11 years before Serrington described synapse. So this was the picture of his contact barriers. If a child draws synapse, this will look like this. And this flow of energy, again, we will talk later. Then one of the major contribution of his was infantile cerebral palsy. CP was known as Little's disease because of the Little's description of it. And he was the authority on this. He said that it was caused by obstetric complications. But Freud in his paper, of course, 30 years later, said that it is due to brain growth abnormality in utero, and complications are the result and not the disease. So he said the obstetric complications are not the thing, but the brain growth abnormality is the primary cause for cerebral palsy. And this was validated in 1980 as only 10% causes are due to birth complications. And his classification is used even today. So after this, he has said that I have not always been a psychotherapist. Like other neuropathologists, I was trained to apply local diagnosis and electroprognosis. And it still strikes me myself as strange that the case histories are right, so read like short stories, and that, as one might say, they lack the serious stamp of science. I must console myself with the reflection that the nature of the subject is evidently responsible for this, rather than any preference of my own. So if you go to his era, what was happening in terms of brain? So there we know that phrenology was in vogue. Dalton was describing brain areas on the skull, which should be skull area should be corresponding to the brain areas underlying, and their shape can describe their size and their function. And people were measuring each other's skull at that time. And of course, there was Broca's aphasia, Broca's localization came into this, and the Broadman's areas, which later came, that people were trying to localize a particular brain function to a particular area. So these two kinds of things were prominent in that time. So Freud had the first divergence from this. He said that no, the brain's functions or psyche cannot be limited to a particular area. They cannot be located, and of course they cannot be located on the skull. So he said that there must be a system, there must be some system which is located. He cannot find where it is located, but he said there are systems in the brain which work together to produce our behavior and to produce our thoughts and other things. So he diverted from this theory of brain, and this would lead to, he said that biology has not advanced enough to be helpful to psychoanalysis. So at that time, he could not locate his structures which he described in the substance of brain, and he diverted to this theoretical concepts. We know the Freud's hallmark where some of the things are like psychic determinism. He said that no behavior is out of the blue. It is preceded by something which determines its behavior. So it can be predicted. So there has to be a prediction of the behavior, and which is determined by the events preceding it. So he came out with psychic determinism. Then of course, the dynamic unconsciousness. He said the consciousness is dynamic. It is ever changing and always seething, boiling, that kind of words he used. And so he described that unconsciousness is very much dynamic. And whatever was happening in physics at that time, he tried to describe that energy dependent system. That brain is an energy dependent system with finite energy, and energy flow is regulated. And if there is excess energy flow, person will feel debilitated. And also said that energy is required for repression and all other functions. And the total store of energy in brain is limited. So this system is energy dependent, and it tries to conserve the energy in this. So this was one of the ideas. And the fourth idea was epigenetic development, like a fetus embryo, from embryo to develops, whole fetus develops. It happens in predetermined time bound sequences, so that the baby develops as a whole. A particular organ develops at a particular time, so that there is synthesis. And if there is alteration or disruption in this, the earlier the disruption, more is the effect. So the earliest description person, the child may not have a limb. Later it may not have a finger, or there may be some minor abnormalities in brain structures, neuronal migration and all those things. So he said the development occurs in this determined stages, even after birth, which he told as psychosexual stages. We know we are talking about anal, oral, anal, Oedipal, and quiescent stages. And most of the development occurs at the age, till the age of 3 years. So that was his thesis. And that development occurs in a predetermined, and any disruption as early as it occurs will lead to more abnormalities in the psyche later. So this was his theory of psychosexual development. And of course, he talked about infantile sexuality and other things. Then he come out with the topographical model. Again, it is not situated in brain. It was hypothetically situated. So we know that unconscious, that drives repressed ideas and affects, and he uses primary process thinking. Primary process thinking is like, it has not sense of time. Construction is not, it does not follow construction rule of grammar, and it flees freely. And then conscious, sensory input from environment, non-repressed affects and ideas, and its uses, secondary process thinking. And pre-conscious has access to both, and mental effort can bring some material to conscious. It also uses secondary process thinking. Then he abandoned this model and he came with this structured model of ego and superego. So he described that E's are instinctual drives. They said that they have force like a biological drive, like hills are migrating and migratory birds coming from Siberia to India, though their parents have come and they have never visited. So that drive, biological drive, it has to be met, and hunger and thirst are biological drives which has to be met. And he said that the instinctual drives are drives having the same kind of force. They're innate and they're also biologically determined us to action. But the pattern of behavior is learning. Like we are eating, so how will you eat depends on your culture, either with hand or with a fork or with a spoon. So all these things changes. But when you are really hungry, all over the world, people, you will eat in the same manner if they are not given food for some days. And he said that this instinctual drives have the same force, but they can be placated. In Bengali, they said, ki, in spite of milk, you can give mattha, doodh ki jagah pe chhach. So it is white thing, and that can be placated in different ways. So which ego does. This is first to develop. It is completely unconscious, and it is ruled by pleasure principle with no awareness of reality. And ego is the second structure to develop in early weeks of life. I have already said, from minimal to maximally developed state in fixed innate sequences in genetically predetermined steps. And it is also depends on maturational factors and experiential factors. So its development will depend on the input from the environment, the caretakers, the mother, and how they are treating the child. It all depends and leads to the proper development of ego. So what we know now, that ego functions, executive functions, attention, thought, memory, intelligence, etc. It operates on reality principle, mediate conflicts among ego, superego, and reality demands, provides coordination and synthesis, and it defends against anxiety. Superego, it develops between 3 to 6 years of age. It is very infantile and rigid, shows thinking characteristic of this age like animism, egocentricity, literariness, and omnipotence. It is reworked during adolescent rebellion and reformed, but may contain infantile residues, so may become rigid. So if you're simplifying this, and this leads to self-criticism based on moral values, also self-punishment, self-praise based on ego ideal, and its most functions are unconscious. So if you're simplifying this term, that ego has no kind of morality. Morality comes from superego, which is internalized societal norms and religious norms, parents' instructions, and all those things. So if I give you an example, if you are walking and in a shop, very good jewelry is there, and we want to take it. So Eid will said that, okay, take it. You want it, you take it. As simple as that. And ego will said, okay, you want to take it, but if you go and take, you will be branded as a thief, may be beaten, and our life may be in danger. So you wait. Either can you steal at night when nobody is there, or you can save money and buy it. So both are acceptable to you. But superego says, okay, how can you think like this? You are such and such person, and thinking of this kind of greed and thinking of stealing is something we should not do. And then this thing occurs. And then ego tries to balance this Eid and demands of superego with the reality demands, with the demands of the environment, how to survive as an organism in environment. So basically, simplistically, I can describe this. Most of the people who are attending it are more than aware of all these things. But just for simplification sense, I have talked about it. So again, another thing is described as the nature of conflict and said that signal anxiety. So when the impending breakdown of controlling and coordinating functions of the ego and the threat that unacceptable id impulses might come into conscious awareness or overt expression. So when this threat occurs, there is an anxiety, which is described as signal anxiety. And nowadays, a lot of experiment has been done about this signal anxiety also. Like animals also have this signal anxiety because uh, the smell of a predator is not something which just points towards that the predator is coming and they run, or they are ready for fight or flight. So they may be afraid of their teeth and being eaten, but the smell itself gives to them the signal that there is a threat, and that leads to the freeze or fight and flight response. Similar function is performed by signal anxiety, and there is a threat that unacceptable impulses may come into the conscious awareness, and person may act on it, or even if comes into awareness, person is not ready to accept it because that is not fitting it with his ego ideal. So like he may have uh, like jealousy for someone, but it does not fit with his ideal, that I am not such kind of a person. So this leads to uh, unacceptable impulses. So different thing others like greed also. He thinks that he is not greedy, but he sees something and desires something so much that that may come into his knowledge that he is really desiring it, and leads to this kind of conflict. So the conflict is that unacceptable id or impulses might come into conscious awareness, or he may act on it. So we see patients like say that I may kill someone. I feel like that I may kill my child. I may feel like I can do this kind of thing. So they're having severe anxiety on this, and this uh, there is this anxiety because they feel that they may do act on these impulses. So when this anxiety occurs, if either ego is not full formed to control the impulses, or ego controls are impaired physiologically, particularly in children or with drugs or old age, they have heightened biologically, like in puberty, sexual urges maybe have been heightened due to the hormonal pull, and social or physical environment so impairs ego or superego functions, or still otherwise well controlled impulses to praise for expression, or both. So like parties when everybody is dancing, and like Holi and other things where socially sanctioned environment to express your uh, suppressed impulses or feelings. So sometimes person may behave in ways in which he will normally not behave, and this so ego function is impaired because of the environmental functions, and ego is not able to control the impulses, or impulses may be very heightened biologically. So this leads to anxiety. And he described the mechanism of defense, that when anxiety occurs, ego mounts its defenses, which are basically unconscious, automatic, involuntarily instituted psychological activities by which ego attempts to exclude unacceptable wishes or urges from awareness. So, when in unconscious judgment of a person, an urge is likely to provoke punishment from others or superego, it becomes unacceptable and require deployment of defense mechanisms. And the first defense mechanism, he says that repression. Repression refers to the automatic and unconsciously instituted processes through which anxiety provoking urges and associated thoughts, feelings, fantasies, and memories are excluded from awareness. And if repression is successful, this will not come into consciousness. But brain has to, or ego has to expend some energy to keep them there. The example is that like you put someone in jail, but to keep that person in jail, you need to have guards. So you have to spend some amount of energy to suppress or repress those impulses. And if you are having too much repression, you will not have that energy for living, and your life will not be so cheerful or happy, because you are taking a lot of your life energies to suppress these feelings. So if repression is too much, this leads to this kind of behavior. And then if repression is not completely successful, then they are allowed to express in some manner which are symbolic of the original conflict, but still they do not threaten the ego. So what the descriptions are like, you have anger on your boss and like displacement, and you displace on something other, bang the door or others. So similarly, symptom formation, this kind of things occurs. Some symptom is formed. You have a chest pain, or pain in the left of the chest, in your heart, so called. So this symptom formation occurs, which again protects your ego, and it allows some expression of your wishes or impulses. So that is very important, that the symbolic representation of symptoms occurs. So this is the basic what I understand about the Freudian ideas. Now coming to the recent, which are the controversial topics, people are talking about it, and there is a lot of controversy regarding this. So this is a paper in Brain, again 2010, and written by KJ Friston, which is basically in neuroimaging and neuropsychopharmacology, Carhart Harris, and they have tried to describe that try to correlate Freudian ideas with recent discoveries of the brain, or default mode, ego functions, and other things, and free energy. So I will just briefly touching this. So the discovery of DMN is something, or default mode network, which I did not knew at least 4 or 5 years back, though it was described in 2000 or 2001. This was something very interesting, and it needed an student, incidentally Indian, a medical student, Bharat Biswal, to identify the paradox, which nobody was talking about. Because fMRI was being done, and people have increased bold signature when some task was given in some areas, and that was being reported. But he, being a student and has open mind, he found that the total bold signals are not decreasing, not increasing when person is attentive. And it was found that in the rest stage, it was taken by Reisel, it was found in rest stage brain is also active, and those areas are active in resting stage are inhibited when we are doing some work, or we are putting some attention or cognitive task. And that led to development or discovery of DMN. And then a lot of people talked about it, and they said that we all had observed this phenomenon, but nobody dared to report it. So basically what it is high level distributed system whose activity is reciprocally related to the activity in cortical areas, subserving task, or stimulus bound processing. Rachel proposed that this pattern reflects a default mode of brain function and functionally relevant physiological baseline. Again, subsequent work has associated activity in the network identified with phenomena such as self-referential processing, autobiographical recollection, mind wandering, and theory of mind, and also the time, concept of time. Regions specifically implicated in DMN include medial prefrontal cortex, the posterior cingulate cortex. It was given quite a lot of importance in this. Inferior parietal lobule, the lateral and inferior temporal cortex, and the medial temporal lobes. and they were anti-correlated with what we call attention networks. Again, they found that they're not only physiologically connected. Diffuser tension imaging found that there are some tracks which are connecting these areas. And this functional connectivity in the DMN is relatively weak in the elderly and in patients with attention deficit disorder and impulse control disorder. Interestingly, medial prefrontal cortex, posterior cingulate cortex connectivity is entirely absent in infants. So it develops what we call ontogeny. It is not present in infants, and it develops later, and gradually it develops, and again in in old age it decreases. These findings implied that the DMN develops through ontogeny in a manner that parallels the emergence of ego functions, that is their quote. And anti-correlated other networks are attention networks, which were, so there was a spontaneous inverse relationship with the DMN. The attention system is activated during externally directed cognition and deactivated during internally directed cognition. Whereas the opposite is true of the DMN, implying a give and take relationship. So regions implicated in the attention system include the dorsolateral prefrontal cortex, dorsal anterior cingulate cortex, the frontal eye fields, the striatal cortex, the superior parietal lobule, the intraparietal sulcus, and the ventral premotor cortex. These regions are active during target detection, attention to spatial detail, and high coordination. Moreover, many of these nodes have been associated with top-down control of primary sensory input. And this was again divided into the salient system, we know, which has been implicated in schizophrenia, and dorsal and lateral cortical system, attention system. So salient attention system was two: salience network and attention network. And bold signals oscillation of DMN system exhibit an inverse relationship with those in posterior cingulate cortex, but the systems do not appear to be well integrated with each other. So salience network and other dorsal attention network, they are not fully integrated, but they are anti-correlated with DMN. So the picture that emerges is of a hierarchy of brain systems with the DMN at the top and the salience and dorsal attention system at intermediate levels above thalamic and unimodal sensory cortex. So there has been hierarchy, and each system tries to control the other system and bring coherence to the system. And they came out with the system of free energy flow, which and prediction errors, which every system tried to do. And the prediction error, the more prediction error, the more free flow of energy. And sometimes they also interact with each other, which is shown in DAS and FPCS in red, and DAS, FPCS and HCMS in deep green. So dorsal attention system. And then they talked about functional coherence. So brain oscillations, that there are spontaneous brain oscillations. Gamma oscillation has been found in resting states and have been produced in mice brain. And alpha oscillations are linked to modulation, and theta oscillations were linked to hippocampal activity. And this interaction between different oscillatory rhythms introduces a structured quantity to the brain activity, and theta gamma coupling has been found. When theta burst is very high, it can control the entrain the gamma also. So this functional coherence is there, and when one area is independently oscillating and coherence is not there, that leads to kind of uneasy sensation and distress, or kind of what we call leads to anxiety kind of things. So if you said that like India is in functional coherence, dominant features of India, but every state has its own culture, character, and working on this. But overall, they are under the control of the centrally Indianness. But if one region tries to be free and do not jail with the dominant oscillations, then that leads to anxiety kind of thing, and force is applied to control that region. So similar kind of thing occurs in this brain of functional coherence. And people have described as a machine, a Bayesian brain. They are interconnected brain system. And there is a prediction. Brain is not only taking information and doing things, it predicts because it makes a map of the previous things, previous memories, previous topography, and tries to predict the next activity. When the next activity, there is a lot of prediction error. We know that dopamine is released. It may be pleasurable, or it may lead to also anxiety. But always it tries to reduce this prediction error. And a lot of experiment has been done that as it is repeated, people were shown a movie in which there were surprises, and it was repeated, there was less prediction error and less activity of the brain. So what happens, they have talked about again primary consciousness or states. Infants and primitive man had its occurrence in REM sleep, psychedelic states, onset phase of psychosis, and dreamy states of TLE. Magical thinking occurs when there is uncertainty and probably more enjoyment. Medial temporal lobe is implicated and coupling is required with DMN to maintain waking consciousness. And a breakdown of hippocampal and DMN is necessary for emerging of primary states, which occurs with psilocybin and LSD and others. They're given DMN is impaired, and there leads to kind of primary process thinking where we experience time as timelessness, either too less or too more, and there is no concept of time, and things are not correlated in linear way. So this promotes critically and windows of segregation in which repression fails and dreamlike images appear in consciousness and spiritual experiences. There has been theory that in fact human consciousness, the cognitive revolution has occurred due to the Amencia mushrooms. When those areas, Homo sapiens reached those areas after taking those mushrooms, and the animals which have taken that mushrooms, there was expansion of our cortex, and there were expansion of consciousness, and all the things as Noah Harari has talked about, that the cognitive revolution separates us from the other primates because we can tell stories, we can formulate things, we can think of the future, and all those things. So after saying this, while how Freud will be useful in our clinic, though I have said 21st century clinic, but in my clinic, it is almost 100 years back. We have only chair and table, maybe some people have couch or examination table with one BP machine and one stetho. And we do not have kind of, some people may have, but we do not have kind of delusion measuring machines or hallucination measuring machines, genome guided diets, genome guided treatments. So all these things is not available to most of us. So what we can do and how we can use. So one of the most important things which Freud said and brought it, that was talked about as a talking cure, was listen and you will understand the person. He said that it is very difficult to hide anything because it will come in the mannerisms, in clothes, in postures, in your voice and others, and you will give all the information to the ear which is ready to listen. So this is the first parameter which we have to do in our clinic. We have to listen attentively. Then there is knowing is cure. If you understand the person, if you can relate his symptoms to something which he knows, and he could understand that why it is occurring, person is almost cured. I will tell some stories also. And then again, symbolism in symptoms. Why this particular symptom is occurring at this particular time. that is very important, and that symbol has to be unraveled, and that will lead to a lot of information being taken from the patient, and which also help him that he will understand that you can understand him, and that is the most important thing in any psychotherapeutic relationship. We have talked, Freud has talked about transference, and people have tried to locate whether this kind of thing occurs in a therapeutic and patient's relationship. So there are moments which has been found that the relation changes, and there is a synchrony between this, maybe the mirror neurons or whatever, and then the person gets well. So something clicks, and something he listens to something, and there is a synchrony between the therapist and the patient, and that leads to his ultimate recovery. So these are the things we have to think in our clinic. So that's very important, like understanding OCD. The OCD is one illness which can be understood, the symptoms, through this psychodynamic mechanisms, and we can understand from where it is coming. I must say, like sexual thoughts. So person is having sexual thoughts towards God or something else which is unacceptable, but he is not feeling distress. That affect is isolated from the thought, and he is not feeling the other, since the affect is not there, he's not feeling excitement, he's not feeling the sexual excitement. And that is thing which we clarify in our OPDs, to understand that what is impulse or sexual excitement towards the other person, not towards gods and others, but towards other person, where it is it is obsessive thinking, or whether it is a really kind of excitement or attachment. Or so one person says he's lives old person, and he finds the girl which is there, uh, she's young girl, and he always thinks about her, but you do not find any excitement associated with this, and he feels distressed. So we get a lot of understanding of OCD if you keep in the mind the psychodynamic mechanisms. Then there's this, of course, commonest we get in our clinic, like students before examination, they have severe tremor of the hand. They say that they want to give examination, they want to appear in examination, they want to do very well, they're very much prepared, but can't do because there is tremors of hands. And this is directly related to their thought about examination, which they are not aware, and which the anxiety about examination they try to cover up by these physical symptoms. Now they have no responsibility because the hands are shaking and they cannot write. And then, of course, the classical pain in chest of left side, almost most of the time it relates to something related to matters of heart in the sense, not in the anatomical sense, but in the sense of literature and others, where love and other things are described as a matter of heart, but it is located in the heart. And a patient comes with the pain in chest, left side of heart, and there no organicity, so almost leads to points towards something related to his love affairs or uh, this kind of thing. And if you ask, you probe these things, you will know the facts. So this thing points, these symbols are there. Again, headache. My sir, Professor S.C. Malik used to say that in headache, you should ask not where is your headache, but who is your headache. So the aggression is there, and which uh, manifests as aggression, as a headache. Again, he said that whatever we hate, we try to do more of it. And we hate our action, weakness, and projections. Whatever things we find wrong in us, we project to others. And if the person has the same kind of weaknesses, we try to hate them, try to castigate them. So this kind of projective symptoms occurs, and you can understand their origin. If you can understand their origin, you can talk and you can manage. And then self-harm as punishment, quite overt. Uh, like still a friend's daughter, she says that she feels that she has not up to the parents' expectation, so she tries to punish herself. She does not take food, she does not sleep, that I do not deserve this, I do not. She also self-harm sometimes, but all the things, and also careers is also suffering. So basically, self-harm is coming as a punishment of superego, which she has internalized. And that very interesting case of a school dance school owner. When I was relatively kind of early in my practice, a whole family came with a person who was having problems, and they said that he is a very nice person. And what happens that when marriage or something occurs, when he sleeps, and if there is any relative, uh, particularly younger female relative near him, he tries to molest him during during sleep. And never other time he do not have any kind of this kind of behavior. And he also says that I don't know what happens to me, I remember these things, but I cannot control myself and do this thing. He was working in coal mines, but he used to run a school for children, particularly female children, for dance. He was the owner, he was not the uh, teacher, but he used to run dance school apart from his own work. And there were small children who used to dance, and he was very particular about them, protecting them. If anybody's father will not come, he will drop them to their home. He will make sure nothing bad happens to them. And there has been no history of uh, any kind of misbehavior except those. So what was happening, I thought. So basically, again, it uh, fits into the schema where sublimation has occurred. He was interested into young girls and tried to have their company. He was having this dance school, and he was very particular about this. But when the proximity and night and other things happened, his control of ego uh, was decreased, and he was behaving like this. So, understanding this and discussing this, and also maintaining distance, leads to solving of this problem. And then dissociative disorders, we know that conflicts in surface. We get call, sometimes I tell my students, like Agatha Christie novels, that there are three layers of truth. You will find one stress which is very simplistic. Person will say that, okay, my mother-in-law is torturing me, so I am having this. I'm having a lot of stress. But that is not the only thing. You have to probe, and you will find other deeper surfaces and deeper stress. So even without going into a lot of things, if you keep in your mind broad principles and think about them, apply to the patient, listen to them, we can use these principles in our day-to-day practice, which still, I may say that still we are quite behind whatever happening in neurosciences and others. But still we do not have a targeted molecule which will or something like a ray, laser ray. Some people may have eyes like that, but laser rays which works on the brain areas and corrects them. Till then, in fact, we have to work with whatever is there. So again, I'm coming to end of my presentation, and again I will quote Freud himself, that must recollect that our provisional ideas in psychology will presumably one day be based on organic substructures. The deficiency in our description would probably vanish if we are already in a position to replace the psychological terms with physiological or chemical ones. We may expect physiology and chemistry to give the most surprising information, and we cannot guess what answers it will return in a few dozen years of questions we have put to it. There may be a kind that will blow away the whole of our artificial structure of hypothesis. So Sigmund Freud beyond the pleasure principle. So coming to again interesting my thought on this, Hippocrates. So 2005 years ago almost, they talked about four humors: blood, yellow bile, black bile, and phlegm, and excess of them may lead to kind of black bile may lead to depression and that kind of melancholia. We, of course, are much advanced after 2005 years of research, and we talk about what popularly is now people are talking like chemical locha. That is a chemical locha, and we talk about there is a chemicals. So there was humor locha, now there is a chemical locha, and there may be RNA locha. I don't know. So still our knowledge is in infancy of the brain, and we cannot pinpoint all the activities and how to modulate them in clinical sense. And there comes the relevance of Freud. So this is the image of black holes collapsing, which sound was heard by NASA and confirmed the theory of gravitational theory of Einstein. We do not know where neuroscience will lead, but again, taking care of our patients with empathy and with listening is what we need and what is required. I must say that again, one story, I was going in a hospital for referral in ICU, and I was in mask, and while returning, suddenly a person called me and said that you are Dr. O.P. Singh. I'm like, yes. So do you recognize me? And I do not recognize you. He was a Sardar Sikh person. Said, I have visited you 10 years before. I was very much depressed. And my job was lost and nothing was there. So I talked with you. You gave me medication, which I did not take. But what you said hit me and changed my life. And I started new business, and I'm really very well off, and could not find you to time to visit you, but I must thank you. And do not remember what I have said to him and whether I can follow that up. But this empathetic bond and listening, of course, it is useful in our clinics, which may be situated in 21st clinics, but for psychiatry, still it may be 20th century clinics. And thank you again for all of you for listening to me.
Thank you, sir.
Thank you, sir. Over to chairpersons for their opening remarks.
Thank you, Dr. O.P. Singh, our own Omda. It's really a fantastic lecture on a very difficult topic, very controversial topic, I must say. But you have very correctly pointed out that probably Freud is still very much relevant in today's psychiatry. I hope so, because though there are certain limitations of his theories, and unfortunately, most of his theories are in a hypothetical form that cannot be proved scientifically. And especially in this era of biological psychiatry, when we are dealing mainly with the neuroreceptors, neurochemicals, and we are dealing more with psychopharmacology, and this we are diagnosing patient in terms of only DSM-5 or ICD-10-11 diagnostic criteria. But psychoanalysis is definitely has its own position, because you know what we learned in our student days, in our PG days, I think the most important is what psychoanalysis has told us is to how to understand the life histories of the patient and to listen attentively. So to listen, I think that is very important to all the psychiatrists who are practicing, and that will help him to diagnose the case more accurately. So I think, and the talk therapy also, you have also already mentioned about that. And I think it is because of Freud and his psychoanalytical theory, this talk therapy or psychotherapy has become very much popular, not only in Western world, but almost all over the world. So this is one of the Freud's most lasting contribution to the field of psychology and psychiatry, I believe. So thank you once again for your very lucid but elaborative lecture on this. So may I request my co-chairperson, Dr. Said sir, if for his remark.
I think the presentation of Dr. O.P. Singh was very lucid, very, actually, people who don't read Freud had a glimpse of what was his life like, what was his contribution, what was his presentation. He talked about everything that Freud talked about. The question is that, is the psychoanalysis still relevant? Because in 2009, there was, in British Journal of Psychiatry, there was debate whether they should accept papers on psychoanalysis case histories. So there is a decline in the interest in psychoanalysis these days. Earlier, they used to have a psychoanalytic sessions which are long and has many sessions or long duration, trying to change the personalities and other things. So probably that is not possible these days. In recent researches, there are short-term psychoanalytic therapies has been started, which are time-limited psychotherapy. But the important thing is that our students should learn certain concept of the psychoanalysis. Rightly said that attentive listening is very important. You should understand why somebody is behaving and why, what are the underlying motivation and other things. So conscious, unconscious, the defense mechanism, the counter-transference, transference. So these things do occur in your daily practices also. If the patient comes and starts telling that you are like a god to me, probably he has a transference, and you have to deal with that. Sometimes you feel attracted towards your patients. There is a counter-transference. These things has to be dealt with even in daily practices. So it is not that these concepts are not important. These concepts are important these days also. And some psychoanalysts have found a link that there may be neurological changes due to psychoanalysis also, and they termed their branch as neuropsychoanalysis. Probably from South Africa, somebody has, and they have their own journal also, Journal of Neuropsychoanalysis, and they say that the psychoanalysis can cause psychoanalytic therapy can cause changes in certain circuits, brain circuits, and level of neurotransmitters, etc. Like has been also been told about the cognitive behavior therapies also. So I feel that our students should be trained in certain concept of psychoanalysis, certain concept that Freud talked about, and we can use these in daily practices. And even that say that short-term psychodynamic therapies or time-limited psychotherapies may be helpful. With these comments, I can hand over to our moderator, Dr. Amrit and Dr. Alim, for discussion.
Thank you, sir. Alim,
Thank you, sir.
raised his hand. And
Yeah, sir. Prasad Rao, sir.
Yeah, thank you, O.P. Singh. Dada, you've done a great job. No, it literally took me for almost 4 decades when I started psychiatry. I have to briefly tell two things. Two people influenced me in my psychoanalysis. In fact, Professor V.K. Verma used to conduct every Saturday our psychotherapy sessions, which we used to do on psychodynamics. He used to interpret, and we were analyzed. We were analyzed as an individuals at that time. In NIMHANS, Dr. Professor Raghuram made us read all the papers of Sigmund Freud. After 110 years, if we are really discussing whether Freud is relevant, I think the answer is very simple. Psychiatry is the most beautiful branch of medicine, according to me. And psychological explanation of some disorders, though over the last 3-4 decades, we have changed to biological psychiatry. As O.P. Dada has very clearly told, three things we still remain relevant. First, the Freud himself during his lifetime changed his concepts as he learned much more from the patients. And that is relevant. And psychodynamic explanation and psychodynamic psychotherapy still stand. The only problem, according to me, is that today's psychiatry teachings is not emphasizing. We have literally gone through 13 books of Freud collection, papers collection. I remember I still carried 6 of them all through from NIMHANS to Chandigarh to Hyderabad back. But I think today's students have to be emphasized. And I think each one of us should really spend some time with our students, especially on the fundamentals of psychotherapy. Dada, you talked about two important things: explaining the unexplained, unexplainable or explainable symptoms of our patients. Headache or a lot of symptoms, symbolic. I think hysteria is one, or what we call today as conversion disorder, dissociative states, and even in depression and schizophrenia, explaining the psychological basis of the symptom is a psychodynamics. Thank you, Dada, for a very nice, and I think we should appreciate the Thursday Musings group from Tufan Pati, Alim, and Amrut for considering a lot of very interesting topics to revisit and make. I hope to listen in another lecture of similar kind in the future. Salman Akhtar, lastly, I had a very good interaction with him, and I still continue to have interaction with him. He is one of the proponent of psychoanalysis, and his returning on the narcissistic personality disorder is a must read for all the post graduation. Thank you very much, Dada.
Thank you.
Thank you, sir. Dr. Gautam Sai is there. Alim.
Yes, let me intervene.
Sir.
We have with us Dr. Puspa Mishra, who is the President of Psychoanalytic Society of India. And from the same premises of Girindra Sekhar Clinic, we have got two persons, Aravinda and Dr. Puspa Mishra. And I have personally requested her to participate in and give her feedbacks. Now, I shall start with a direct question. What is the relevance and how much you are having the psychoanalytic psychotherapy today? And what is relevance to understand a patient in general clinic? Madam, please.
Yeah. Thank you very much. I first of all would like to thank all the organizers for inviting me to this elite gathering. It was a really wonderful session that I heard. And I would secondly like to thank Dr. O.P. Singh for presenting such a beautiful paper. I mean, it is not very easy to present Freudian theory in such a lucid form. For simple reason that he has talked so much, he has written so much that all the writings, his writings actually comprise 24 volumes. And therefore, to concisely and clearly present the main things of his theory, it is a very difficult task, which Dr. Singh has accomplished very nicely. As far as the question of relevance and the question of importance of psychoanalysis in our 21st century clinic is concerned, I would like to say two things. One is the fact that it is not being considered relevant is one, lack of scientific evidence. It is considered that psychoanalysis or psychoanalytic concepts are not very scientifically approved. The scientific evidence is lacking. And the second is the long therapy process that it takes. Whereas in 21st century, we all are actually trying to be short, trying to have brief therapy, because our profession and the changes that have taken place with technological advancement, they do not allow us to spend too much time on therapy process. CBT and other behavioral therapy, they treat their patients by already having a contract of 10 sessions, 16 sessions, etc. Freud would have been horrified, and he certainly wouldn't want psychoanalysis to be short therapies. I would like to point out one thing, that psychoanalytic therapy is long-term therapy is no proof that there is no truth in it. I mean, market value and changes in cultural circumstances and the demand for shorter therapies actually need not be correlated or commensurate with the truth or falsity of the theory. The theory can be true, its hypothesis may be true, maybe because of certain cultural changes one wants to have shorter therapy. Psychoanalysis also now has more or less understood this necessity, and short forms of therapy, psychoanalytic and psychodynamic therapy, have already started emerging with complete scientific evidence which bases their results, which actually confirms their results. So we have Luborsky's supportive expressive therapy. We have other forms of psychodynamic short therapy and brief therapy. As far as the first question is concerned, the lack of scientific evidence that was true at one time. And I think it was a good thing that psychoanalysis actually did face a lot of criticism because of the lack of scientific evidence. Freud, for example, he was himself a very scientifically oriented person. He modified his theory in the light of empirical evidence a number of times. For example, he modified his theory of seduction, theory of hysteria. He modified his dream theory a number of times, twice at least. He modified his theory of or his concept of anxiety 4 times. So as he gathered empirical evidence from his patients, from the clinical data, he modified his theory in light of those empirical evidence. But I will also say that as far as quantitative and statistical method is concerned, first of all, it was not so much prevalent in those days. And secondly, Freud was abhorrent of it. I remember a small incident where a gentleman actually said, a doctor in fact, that he has some statistical proof that Freudian theory was right. And Freud answered him that my theory does not need any statistical support. Our clinical data supports our theory. But that actually later on certainly was not true. Nowadays, innumerable experiments have been done, and they have been done following all the scientific methods which are required for any kind of scientific experiment. Surveys have been conducted where the sample size was as long as 10,000, and the numbers have been taken, the control and the experimental group was formed, taking people from different countries. And it has always been found that even short-term psychotherapy is better than any other form of even CBT or behavioral therapy. Its effects are much, especially long-term effect. If you come to long-term effect, the therapy actually has been proved to be much more beneficial than any other form of therapy. So nowadays, this attitude also actually has changed, namely that scientific evidence is lacking. Scientific evidence no longer is lacking as far as the research and the surveys indicate these days. The effectiveness of the therapy also are not lacking. Yes, it does take still some time, maybe, for CBT, you have a contract of 16 sessions, but it has also been found that CBT's effect are not as long lasting as the effect that has been done by short-term psychodynamic therapy. So I think that from these points of view, namely regarding whether psychoanalysis is relevant or not, these 2 objections that actually have been raised, they probably are no longer true. And the second, and the only thing that I would say, Dr. Singh has already said, try to listen to your patient. Try to understand what they are trying to say. Even if you do not believe in psychoanalytic theory, but their pain, their, mm, their anxieties, and their displacement of symptoms, that actually can be understood even if you do not believe in therapy. But if you believe in the complexity of human mind, if you believe in the cognitive process that is going on in our mind, that itself probably would help you to understand the patient better. Just listen to the patient. And from that point of view, talk therapy actually has been proved to be extremely there are many cases, but I remember of one I read in one of the papers that there was this lady who had gone to so many psychiatrists and has been treated. But then she came to a psychotherapist and said, I don't want any medicine. I just want that somebody understands me, somebody listens to what I want to say. So a patient actually wants that. We have neuropsychoanalysis, as Dr. O.P. Singh has pointed out. One thing that I would like to mention is that Freud's probably most signal achievement was dream theory, and it is dream theory which actually has been criticized so severely by Hobson's activation synthesis theory. It was again a neurobiologist. It took a neurobiologist like Mark Zorns to find out the physiological basis of dream theory and to prove Hobson completely wrong. For 20 years, there was no research grant given by America to any academician to do any kind of research work on dreams. After 20 years, when Mark Zorns could prove activation synthesis theory wrong, then only the evidence was there that Freudian theory is true to a large extent. I'm not saying that you idealize Freud or you idealize psychoanalysis. I'm also not saying that whatever Freud has said is true. There are many things of which Freud has said about which I myself, I do not accept. For example, I do not accept his penis envy theory. I do not certainly accept that all dreams are wish fulfillment. I do think that dreams are extremely significant. And just before your session started, I had ended a session of one of my patients in which in the whole session, the patient had related a dream and said, in fact, that if you want to go to puke, you can go to it. I do not know how to relate this dream to you. So dreams do affect human mind, and they do give us an indication of something very, very significant, which is present in the patient's mind. And I think that if we actually listen to the patient, even listen to their dreams, with the knowledge that psychiatrists possess of seeing so many patients, it can help them better to understand the patient better. And we appreciate the help that we get from psychiatrists, because in some cases we simply have to take the help of psychiatrists, though there are lone cases. I think one case at least where schizophrenia has been cured just by psychoanalysis and without the help of any psychiatrist. But in most cases we do need the help of psychiatrists. So if, as Freud has said, maybe sometimes if both of us, both the disciplines can come together and each may try to take the best that is there, I think it will be a much better program of treatment, and we can help our patients in a much better way. Thank you very much.
Thank you, ma'am. Dr. Anil is waiting.
Sorry, just I want to answer one question. Allow me to share. Just a minute. I was ready for that. Regarding homosexuality, in a letter written to an American mother who asked him about his son's homosexuality, Freud wrote, homosexuality is assuredly no advantage, but it is nothing to be ashamed of. No vice, no degradation. It cannot be classified as an illness. We considered it to be a variation of the sexual function produced by a certain arrest of sexual development. Many highly respectable individuals of ancient and modern times have been homosexuals, several of the greatest among them. It is a great injustice to persecute homosexuality as a crime and cruelty too. So I am not going into his theories because he believed in dimorphism and bisexuality, in fact, kind of Ardhanarishwar concept. And he was this was long before the DSM or others, which considered, you have to think in perspective. When he was talking, what was the culture at that time? And you cannot interpolate that to this day. And that time, it was revolutionary to say that homosexuality is not a disease. So he was, in fact, quite liberal and supporting rather than harming that cause. Thank you.
Thank you, sir. I think Dr. Gautam Saha, Dr. Ajit Bide, Dr. Nil Nishchal.
Yeah, we'll take first Dr. Gautam.
Dada.
Dr. Gautam da.
Hello.
Dada.
What to say? What to
Sir.
say? Actually, last 1.5 hours I only talked. Na, OP bolna और मेरा बोलना में कोई difference है क्या? As a jokes apart, what I am saying, it is a fantastic talk. And in fact, I suggested OP when we discussed. OP asked me what to talk in the 50th anniversary of Golden Jubilee of our Thursday music. So I suggest this topic because I listened this topic from him earlier also. It was so fantastic. In fact, sometimes I used to tell OP that in a cricket match, sometimes Sachin told Saurabh, you don't know what talent you have. Even you don't know. It's like that. OP is a really multi-talented and very much talented. And I always consider him that he was always underrated. He might get, in fact, I am so happy that in the national platform, in the Thursday Music Club is almost a national platform. He's presenting this. I'll be more happy if it is the international platform. It is a deliberation. Anybody can just respect. Thank you, OP.
Thank
and
you so
thank
much.
you, Dr.
Gautam is praising himself.
My dear brother,
Said.
Amrit, and also,
Sir,
and also Alim Bhai, all of you and the all respected senior colleagues and my dear friends, younger friends. Thank you so much.
Gautam da, may I interrupt? OP sir ने आज javelin फेंका है 90 meters पे. आज 90 meters फेंका है OP sir ने javelin.
Yes, sir. Thank you. Yeah.
Thank you, sir. Thank you so much. Ajit Bide, sir, any comments from you?
First, my apology because I was in and out because I had an emergency there. Just trying to seem a little busy. Anyway, whatever I heard from OP was very, very gratifying, and it was a very sober, very considered, very objective view of psychoanalysis and how relevant it might be in our clinics today. I think it was fantastic, and whatever I heard was extremely impressive in that context. For me, Freud is at once a genius and an idiosyncratic authoritarian bully, because I think Professor Misra made the very valid point that he did have a scientific outlook. Salovey has written a book about this called Freud, Biologist of the Mind. And I think that's a book I would advise our students to definitely go through. There's another book that I read during my post-graduation, which influenced me against Freud and Freudianism. It was a book by a guy called Campbell, which said Induced Delusions, the Psychopathy of Psychoanalysis. And that is a very hard-hitting critique of psychoanalysis, because psychoanalysis had a sort of fatal grip on the practice of psychiatry, especially in the United States. It used fanciful language, it was very esoteric, and it seemed beyond the reach of common intellectuals. You had to rise to be a psychoanalyst. All that myth went away. But for me, Freud gave great understanding. It has been emphasized, of course, that the respect for the patient, emphasizing interaction. And for me, the importance of defense mechanisms, much more elaborated by his daughter and also mentioned by OP, important. He was a very idiosyncratic man in that, he took a single case to formulate some of his theories. The case of Judge Schreiber has been used to explain all of paranoia as based largely on projection, which is something I find he never corrected. So Professor Misra did rightly tell us that he updated many of his theories. His theory of paranoia, he never really updated, and I think that is most unfortunate. Also, from time to time, whatever were his preoccupations. So he was preoccupied with sex. He had no more than one dalliance. And that's why sexuality got psychosexuality got such prominence. But when he reached a stage where a fatal illness was diagnosed, that's the time he got Thanatos into his realm. The final point I want to make is that he started this trend of cultism. You belong to a Freudian school, you cannot belong to a Jungian school. You belong to a Jungian school, you cannot belong to an Adlerian school, which did not exist in psychiatry until Freud comes on the scene. You have almost a religious adherence to some sets of theories. When Freud modifies his theory of dreams, you modify your theory of dreams. It reminds me of what we have in India. You have these mathas and you have mathadipatis, and you follow that, you dare not question it. That kind of cultism is something I think has brought some shame and ruin to our subject to some extent. Nevertheless, to question him as a very wide-ranging thinker, there's the famous correspondence between Einstein and Freud. When the United Nations, when the League of Nations actually was debating about the inevitability of war, there was a fantastic interaction between these two in the form of letters. And I think the other thing we should go to is Freud's replies to Einstein about the inevitability of war, and his understanding of the instinct to be hostile is worth reading. Thank you, OP. Sorry, I got into too much gyan myself, which is not correct, but I enjoyed listening to most of your lecture. Not that I didn't enjoy the rest of it, I didn't hear the rest of it.
Thank you, sir. Thank you, and for complimenting all the things which I have not said.
Thank you, sir. Thank you, sir. Amrit,
I just want to say, sir,
I think
it was limited to the, as you say, exclusive class and private practice. But all the government institutions were free from this. And some bad shame was brought by psychosurgery and others, more than what he brought to psychiatry, and which was not influenced by him. Because he was very limited to kind of private clientele. Psychoanalysts are limited to private clientele and affordable class. And all the government hospitals, brick and mortar hospitals, where major treatment of psychiatry was done. And that their conditions and their treatment, that brought distribute more to our psychiatry rather than what Freud said and did. That is my opinion, sir, personal.
Any other senior people who want to speak on this?
I think Dr. Anil is there.
Dr. Anil
was.
I'm not that senior, Amrit and Alim, but if you allow, I can.
Senior to me, junior to Alim actually.
No, I am senior to Alim also, but not that senior. Not that senior to speak in the august company of Tufan Pati Saab and Ajit Bhire Saab and OP Singh sir. But still, if you allow, I would like to speak a few words.
Sure, sir. Go ahead, sir.
Yeah. First of all, I wish to thank OP Singh sir for such a lucid and such a clear presentation of Freud. My feeling is Freud, as I have understood the things, Freud is not always correct. And most of us feel that. In most of his things, sometimes he is not right, sometimes he is overboard, but at times there are many things in which he is actually useful in our clinical practice. So that is my feeling of Freud. And जैसे OP Singh sir ने कहा कि Freud in clinic at times helps us. My concern is mostly about the contempt we have towards Freud as a whole. Freud should not be classified as black or white. He should be classified, we should take him as gray. He was also a human being. He made his mistakes. That's all right. He might be wrong at certain places. He was speaking some 100 years ago. So he might be wrong in some things. But that does not mean that he was not intelligent enough. Many of his things, we feel that and we see that they are right in our clinics and they help us to treat our patients. There are multiple things and OP Singh sir enlisted a lot of them. I think we should have a balanced view of Freud and we should take his good points, and whatever he actually sort of appeals to common sense should be taken up. And there is a sort of wave against all these things, which is not correct. The keyword is balance. We must understand that he said this was the history, this was the evolution of psychiatry, and where we are, where psychiatry is headed, and we have to have a balance amongst all those things. That said, I wish to thank OP Singh sir for very lucid and a very nice lecture. Thank you, sir.
Thank you, sir. Thank you, sir. I think we are running a bit short of time. जैसे psychoanalysis में होता है, time is not limited, but again our time is limited. Sir, OP sir, rapid fire questions from me and Amrit. छोटे questions, some from the audience, some from others. Sir, अगर if there was no Freud, where would psychiatry be now? How would have been the trajectory and evolution of psychiatry if there was no Freud?
I think as a discipline would not have been existed perhaps, and a lot of people would not be in the subject. Saying this, the things where the brain development was never hindered. Of course, in America, as I said, that some circles it was happened. And they are very dogmatic, very cultist. They did not allow any kind of person to, you have to be psychoanalyzed to do something. So that kind of control was completely there, like a Mathadi says, what he has said. But at the same time, the neurology and other things were very free to explore the brain and all the behaviors. There was no detriment to that. But something we cannot do that because still it is limited by this our knowledge. This is so complex and machine. They still basically computational science. They are doing the real research now because of the understanding which they are bringing. So I don't think that trajectory would have been much different if psychiatry would have been with neurology or neurology would have been only one subject.
Can I tell? Hello.
Yeah.
OP, what OP said, I am telling just 2 to 3 words. It is not that science is truth, it will reveal. Whatever, it does not depend any person. May not be, it is Freud or anybody else. But still, the discovery may be delayed. Whatever it may be, Freudian the contribution from Freud is always there. And if he is not there, we cannot do as fast we do. Whatever the place in psychiatry right now, we cannot deny his contribution. But still, at last, I am telling one science, one subject cannot depend on a single person. So that should not be a question. It will, maybe someone else will do that. But yes, he is the first person who makes this psychiatry popular, who make the people think on psychiatry. Even in the back now, it is absolutely bogus because whatever doing 100 years back, and there are lots of things what Dr. OP Singh mentioned, is still we are standing that place on. That is my view. Thank you so much.
Like Eric Kandel, who was a psychoanalyst, and he took psychiatry because he was very much impressed by Freud. And while discovering the origins of memory, he worked on the origins and synapses, ganglion and changes and long-term potentiation, how the memory is formed. And that led to discovery and for which we got Nobel Prize. So it is not that somebody is hindering, somebody is not doing. It is open and everybody can do their things. Thank you. That is, again, I agree with Gautam.
Sir, when we talk of hierarchy of evidence, हम बोलते हैं there is RCT, there is case series, there may be qualitative studies. So I think most of the Freud's theories were at that time based on this personal experiences and case descriptions, as you just mentioned. Is it so, sir? Can we agree to that?
Of course, he himself has said that neurobiology was not sufficient to support his theories. And that was a theoretical foundations. Even Einstein's were theoretical foundations with mathematical calculations. But of course, many of his theories are wrong. But that time, nobody in brain was doing something different, and his theories were providing insight into the human behavior. So there were great neuroanatomists, great neurologists, but they also could not do, and still we do not have that insight into the human behavior. That is
sure.
That
So
is
I think it was his astute power of observation and ability to conceptualize things
yes.
at that point of time, जहाँ पर science था उस समय, to be explored further, and many things will be negated right now. Some things will be accepted, but his observations and interventions, they are quite acceptable still.
Thank you. You have nailed it.
Okay, thank you, sir.
So, Alim, there are a lot of questions. I think it will be unfair if you take few questions and we don't. We'll call OP sir again. I think it's
so, sir, he has to be called again because
we thought that we'll ask you 3 questions. Alim asked all the 3 questions. So, as usual, I have to cede space to him. Dr. Tufan sir, for the final conclusions, and then we'll give the thank. Tufan sir.
So
I thought hearing Alim, you also ran away.
it was a splendid talk. I enjoyed it, and I keep on listening to it. Although I am moved now, I have left my home and going to a different place on some urgent need. It is wonderful. I suggest we can call OP again and have more case picnics and have more discussion. And the Amit has given me the scope to ask. I take this opportunity to tell that I shall be switching off now. And I thank everyone, both the chairpersons, all the participants, and all the experts of psychiatry whom we have seen today. And to tell so much, after such a long gap, still the attendance is very high. OP's presentation was very great. We'll call him again. With this, I take off.
Sir, thank you, sir. You look very sweet with your mask on, sir.
Platform. You people have made it in India at least. The most premier platform, and I'm honored.
Okay, mask utha diya.
You look very sweet with your mask on and with the 45-degree view. Thank you. On behalf of the IPS Odisha State Branch, I would like to thank OP sir, my teacher, who's been wonderful. The way he conceptualized, the way he, the neurobiology, and Alim's thought about, 1 or 2 cases and going into it and then getting a lot of theories. I think nobody has done more good or bad to psychiatry than Freud. I will tell like that. So everybody, he has actually polarized things. He has brought psychiatry into focus. If you look at non-psychiatry people talking about psychiatry, they talk about Freud. There are a lot of people who come to me and I'm afraid when they come, they ask me a lot of questions about psychoanalysis, which I don't know. Forget Alim. When I don't know, he must not be knowing. So those are the things we see. Thank you so much, OP sir. Pushpa madam, we hope you will come to our platform again. It was wonderful having you. You are the icing or the cherry on the cake. Thank you for coming, attending, and giving your valuable inputs. To my teacher, Dr. Said Akhtar sir, it was lovely meeting you after such a long time.
Okay, thank you very much.
You still look fresh and energetic and vibrant. Thank you so much. It was as if we were 20 years back. Thank you, Arvind. With a deep, he looks like the psychoanalysis person.
Serious analyst.
Thank you, Gautam.
Thank you,
sir. G. Prasad Rao, sir.
I think Mohan Isaac sir is there. If he's
yeah. We can ask for your input, final input.
Mohan Isaac sir, if you are around.
I'm very much around.
Sir, your input. Sorry, we missed you.
We missed you, sir.
Thank you.
I mean, it's already quite late. I just want to add a couple of things. One, I enjoyed the talk by Dr. O.P. Singh, relevance of, in fact, I logged in mainly to see, okay, what is Dr. O.P. Singh going to say about Sigmund Freud in 21st century? But of course, he lived up to the expectation of all the audience. As was said by Amrit, he combined the Freudian psychoanalysis with the current neurobiology, etc. But I just want to make 3 points. One is that I was delighted to hear him talk about Eric Kandel. Eric Kandel went to a medical school in America. Of course, he was born in Vienna. That is a place where Sigmund Freud worked for 47 years. So he's a Viennese American medical doctor, and he trained in psychiatry in the classical traditional psychoanalytical mode. As was mentioned by O.P. Singh, he wanted to do psychiatry because he had such immense, regard and respect for Sigmund Freud. And during the 50s, 60s, American medical school trained psychiatrists in psychoanalysis. There was no medicine, there was no biology. It was all psychoanalysis. But what is, I think, a lesson for all of us is, as he advanced from a psychoanalyst, he became a clinical psychiatrist to a neuroscientist. And he also, I think, holds a professorial position in biochemistry. His work on memory, etc., and he won the Nobel Prize. One of the few people who have a psychiatric background in modern days who won the Nobel Prize for, that is one thing. And I was delighted to hear him refer to Eric Kandel a number of times. It is linking the old. Maybe Freud, if he had the kind of methodologies and mechanisms that we have, he would have probably done many things. He would have won Nobel Prize. Ajit mentioned that he was immensely intelligent man and he was an astute man. Now, the second point I want to mention is something which I was myself amazed when I first went to Vienna in the 1980s. One of the reasons I went to Vienna, of course, my meeting was in Munich, but I deviated to travel to Vienna, was to visit Sigmund Freud Museum. Sigmund Freud Museum is in 19 Bergasse, which is in Vienna. That is the house where Sigmund Freud lived for 47 years till 1938. Then the Nazis, because of the Nazi problem in Vienna, he had to move to England. And then, of course, the next year he died. But this is a wonderful place. This is a house. I mean, people who have read about Sigmund Freud, whether he is relevant today or not, I believe he is greatly relevant. I'm not going to talk about that. But what struck me was that even before the first 2 or 3 days in Vienna, as I was, going around seeing, the other reason why I went to Vienna was it's a place where Beethoven lived for 35 years. And those days, my young daughter was learning piano music and going through Beethoven's, sonatas and concertos and all that. Anyway, what struck me was the 50 shilling Austrian shilling note at Sigmund Freud on that. Just like you have 100 rupee notes and 200 rupee notes here with Mahatma Gandhi. And we know why Mahatma Gandhi is the father of our nation. That's why he is on the notes. I don't think anybody from psychiatry, psychology, for that matter, not many scientists would have come on the currency note of a country. Unfortunately, Austrian government withdrew that Sigmund Freud 50 shilling notes in 2005 or something like that. But in the 1970s and 80s, it was part of the currency. In fact, I still have that 50 shilling currency with me, which very proudly I keep because that is Sigmund Freud on the currency note of a country. And the third point I want to mention is, of course, I did mention about Sigmund Freud and Albert Einstein letters and all that. But I wanted to mention about a book which is titled Copernicus, Darwin, and Sigmund Freud. They are three people who brought on great revolutions in the history and philosophy of, science and thought. I'm not going again into the details of that. All of you know about Copernicus revolution. All of you also know about what Darwin said. But then there was another paper in the Scientific American, again on the same theme, Copernicus, Darwin, and Freud, a tale of science and narcissism. What I wanted to say was that Freud wrote about Copernicus and Darwin, saying how, how they heard the narcissism in humanity by saying that Earth is not the center of Earth, but sun is the center of Earth. And Darwin, who said that we are not creatures created by God, but we have evolved from the tiny amoeba, etc., etc. But many people think that Sigmund Freud also was a narcissist in a way. Ajit referred to that in some ways, but he also contributed to, puncturing this narcissism, when he talked about sexuality and the unconscious and how very proudly we talk about ourselves, but we talked about the ego, superego, how we have to look into all this. So it's been a marvelous evening. And my personal feeling is that Freud will never be relevant. Whatever he said may be true, may not be true, can be proved, cannot be proved, but he has had tremendous influence on human thought. Even today, I think Amrit referred to how frequently we refer to Sigmund Freud in our lay language. Every day, in any walk of life, at least a couple of times you refer to Sigmund Freud, maybe about defense mechanisms, maybe about Freudian slips, maybe about psychosexuality, etc., etc. I don't think his contributions, obituary can be written so easily. It will be there. Whether he said the nonsense, I mean, as people say, in his envy and all that, people laugh now when you talk about it. And the last thing I want to say is that I think Syed Akhtar mentioned when he joined psychiatry, there was Shashi Pandey. When I joined psychiatry, the textbook, the comprehensive textbook of psychiatry, which we bought, of course, very expensive at that time, was the second edition. Today, I think it is 6th or 7th edition. It was a very fat book by all standards, but more than 50% of that was all on psychoanalysis. I'm referring to 74, 75, 76, when we all had to read. I mean, good or bad, I'm Prasad Rao referred to, Raghuram asking you to read all the work of. Now, see, those were the days of no Facebook, no telephone, no mobile. But how did he have so much influence on human thought? He was a prolific talker and writer. He could influence people. So he will always be there. He will always be relevant. Thank you very much for asking me to make this contribution. Back
Thank
to
you so much.
Thank you, sir.
Wonderful, sir.
Thank you again, Dr. Mohan Isaac, sir. Lovely hearing you. You summarized everything so well. Talking about Vienna, going to Freud's, we all have gone there. Whoever has gone to Vienna, click pictures there. Whether we like Freud, whether we dislike Freud, it was a moment that everybody cherished. If that was a moment in our life, going to that museum and clicking pictures. Thank you so much. Thank you to the visiting team. Tufan sir has again rejoined. Sir, we are closing it now. So thank you, the musing team.
Yeah.
State Bank,
Just when I when I opened, Dr. Mohan Isaac was speaking. So I took excuse from my other persons around here. Thanks, everybody.
Thank you. Good night. Good night.
Okay, sir,
we have a message from the chat box. Let's go to Vienna again. With that, we end this session. Good night.
Vienna, sir. Okay, sir, we are sending the questions and we'll call you again, sir.
In fact,